How you doing? My name is Gianni. I'm going to be your student physical therapist today. So we're just going to test a couple cranial nerves, okay? So what we're going to do first is we're going to do a visual fields test. So that is looking at somebody with bilateral or bitemporal hemianopia. So they're not going to be able to see very well on the lateral or the outside portion of that visual field. So I would do a confrontation test. So what I'm going to have you do is I'm just gonna ask you when you see my finger. Okay. So I'm just gonna start out and bring it in, and you just let me know. So I'm gonna have you cover whichever eye you want to first. Okay. So I'm gonna start here, and then you just let me know when you see the finger.
No.
Okay. Go from here.
No.
Okay. And then we would do that for all 4 quadrants, but let's do it on the other side. So let me know when you feel it or see it.
No.
Okay. This way.
No.
Okay, so that would be a deficit because obviously that visual field is affected, that lateral visual field, so we would have to look into that more. A positive test would be if she could kind of see from that visual field from kind of out in this area here. The next test we're going to do is a pain test, and this is with left hemianopia, so they're not going to be able to see in that left eye. So what I want to do is I want to show her the test on that right side of her body, right eye, so she can see what's going on. So what I'm going to have you do is you're just going to tell me if you feel a sharp or a dull pain. So this will be sharp and this will be dull. Okay. So what I'm going to have you do is close your eyes and you're just going to let me know when you feel sharp or dull.
Okay. Sharp. Sharp. Dull. Sharp. Dull.
Okay, good. So she did a good job there. It would be an abnormality if they couldn't distinguish between the sharp and dull, or they just couldn't feel the touch in general. So then the last test we're doing is a tactile localization test. So this is with a person with a Wernicke's aphasia. So explaining things in complex wording is going to be difficult for them to understand. So I have to do it with very simple commands. So I will be touching parts of your arm. You let me know where you feel it on your arm.
Okay.
So close your eyes. Let me know where you feel it.
My shoulder. My hand. My elbow. My hand. My shoulder.
Okay, good. Yep, and then for that, and with the pain test, we would test upper extremity and lower extremity, the upper and lower parts of each extremity, and then we test anterior, posterior, medial, and lateral. And then with this one, if it was an abnormal test, they wouldn't be able to distinguish which body part I was touching, or they wouldn't just be able to feel it in general. Awesome, thank you so much.
Thank you.